This video will go over the pre-assessment and the assessment of blood pressure, as well as the protocols of taking blood pressure and also the normative values of blood pressure. The equipment needed for this assessment is a stethoscope and a sphygmomanometer created by Russian physician Dr. Nikolai Kordakov. The pre-assessment protocols are very important for acquiring accurate results during the blood pressure assessment. The patient should be seated in a chair with back support for at least 5 minutes with their feet flat on the floor and uncrossed. Their arms should be elevated at heart level. It is also important that the patient should not ingest caffeine or nicotine at least 30 minutes prior to the test, and also very important that the proper sized cuff should be worn. Keep in mind that the cuff should be placed over the bare arm of the patient so results are accurate. Now it is time for the assessment of the blood pressure. The cuff should be firmly wrapped around the upper arm with the artery mark aligned with the brachial artery. The prongs of the stethoscope are facing forward and the bell of the stethoscope is placed over the brachial artery, making sure it is not placed under the cuff. Be sure that the valve is turned all the way to the right before inflating the cuff, or else it will not inflate. Quickly inflate the cuff to 180 millimeters of mercury. Once that is reached, turn the valve to the left so that the deflation can occur at a rate of 2 to 5 millimeters of mercury per second. As the cuff begins to deflate, pay close attention to the Kordakov sounds. The first Kordakov sound is the systolic blood pressure. The last Kordakov sound is the diastolic blood pressure. Systolic blood pressure is the highest pressure in the arteries during the contraction phase of the heart. Diastolic blood pressure is the highest pressure in the arteries during the relaxation phase of the heart. The normative values of blood pressure show that systolic blood pressure should be less than 120 millimeters of mercury and diastolic pressure should be less than 80 millimeters of mercury. The prehypertensive category for blood pressure is to have a systolic blood pressure of 120 to 139 millimeters of mercury or a diastolic blood pressure of 80 to 89 millimeters of mercury. There are two stages of hypertension. In the first stage of hypertension, there is a high blood pressure with a systolic pressure of 140 to 159 millimeters of mercury or 90 to 99 millimeters of mercury for diastolic. The second stage of hypertension has a systolic blood pressure of 160 or higher or a diastolic blood pressure of 100 or higher. If a patient has a systolic blood pressure of higher than 180 millimeters of mercury or a diastolic blood pressure of higher than 110 millimeters of mercury, he is considered a hypertensive crisis and needs emergency care immediately. It is important to understand how to take blood pressure and what the values of blood pressure mean, so that the appropriate exercise program can be prescribed to the patient. Thank you for watching the protocols of pre-assessment and assessment for recording blood pressure.